you know, the aspect of managing people, selecting people, and picking the right people for the job is of high importance. So let's go to, no, let's not go, let's go back. See if we can, previous slide. Okay, so let's talk about the first thing today, which is understanding the recruitment and selection process within health and social care. So I'm sure that you can imagine that within health and social care, there's a lot of jobs going, there's a lot of positions, there's a lot of roles. So off the top of your head, fire some jobs at me within the health and social care. What type of jobs would be involved in particular health and social care? Litz, do you want to? What type of jobs have you seen within the health and social care industry?
Well, social workers. Social workers.
Okay.
Can you hear me? Social workers.
Not really. No. Okay.
I said social workers.
Social workers. Yeah, that's a good one. Yeah. So yeah, that's one job within the health and social care industry. Emmanuel, how about yourself? What type of jobs would you feel are in the health and social care in the industry?
If I could give an example, I think we have the Red Cross. The Red Cross is an international organization.
Okay.
They are more prevalent in countries that have been ravaged, with conflict, especially presently in Nigeria. I'm a Nigerian, so presently in Nigeria, where there's the northern part of the country, is being ravaged with terrorism. So many people have been killed. So presently we have the presence of the Red Cross, providing first aid. They are providing first aid, providing food and some other social services for the affected people or the victims. So first, the Red Cross workers could be referred to as the social workers.
Okay, that's cool. That's good. Thank you for that, Emmanuel. So as we all have heard, Litz and Emmanuel have all given certain jobs within health and social care. So I'm just going to go through, one second, I'm just going to go through a few jobs within the health and social care. So you'll have occupational therapist. So what an occupational therapist does, they will come into people's homes. They will come into people's homes. They will see what people need around their rehabilitation, and then they will provide the equipment that is needed for the service user to be able to manage at home. You also have district nurses, community nurses. You also have other like roles, so consultants, GPs, doctors, care workers. So there's a lot of roles and there's a lot of fields in the industry that we need to pay attention to. So the first thing we want to look at today is understanding the recruitment and the selection process within health and social care. So as we said, in health and social care, like there's a huge number of people now joining the industry today. So, you know, you may have seen the news, you may have been eagle-eyed about NHS and the drive between getting more people into the social care industry today. This is because like there's a need for it, and there's a need for professionals to be joining the health and social care industry today. So as we know, when you're looking for people within the industry, there's normally a selection process, and there's the recruitment part of it, and then the selection process of it. So I'm sure most of you may be aware that, you know, when you're going to apply for jobs, when you're looking for a job, you'll go through two types of processes. You'll go through a recruitment process. So that's anything from applying for a job. You may be going for an interview. You may be asked in for a trial shift. You may be having like this, a one-to-one with the setting of the place that you're going to be working in. And so all of that is part of the recruitment process. Now the selection process is a different cup of tea. It's a whole different ball game. So when you're going to select people, there's often certain criteria that they are looking for. There's certain criteria that, you know, that they are going to be looking for, aren't they? So as we see here, the process is normally a rigorous one. But for employers, it's an even more tougher process. It's an even more bigger process, because why? Within that particular process itself, they've got to pay attention to certain government guidance, legislations, and recruitment as well. So off the top of my head, you know, some of the legislations, you know, you've got the Safeguarding Act, you've got the Health and Safety at Work Act, you have you know, the Disability Discrimination Act, you also have the Care Act 2014. They're just some of the legislations that, when you come to recruit, is what you have to look at. And then like another factor is also, you know, it's also about their recruiting. So, you know, like, how do they actually recruit for that particular place? And also, where can they recruit? And also, who should be involved in the who should be involved in that particular process, and who exactly should they consult? Because as we have said, like, there's so many jobs out there within the recruitment, the health and social care industry today. And as I'm sure you are aware, that there are going to be certain people who will want to see who you are recruiting in your business. So let's move on. So let's talk about the recruitment process first. So when it comes to recruiting certain people, it is very likely that, you know, within your setting, within your the place that you work, or the provider that you may be contracted to, normally 9 times out of 10, it will come down to the managers, the leaders, and also the senior partners within the particular setting, So if we think of NHS, maybe you'll have the managers, you'll have leaders, and you'll have senior partners within NHS. So they will come together, and they will discuss what type of person they would like to recruit. So let's look at that particular thing for a minute. Why is it important for the leaders to see what type of person they would like to recruit? Emmanuel, why is it important for them to highlight the type of person that they want to recruit?
It's okay. I think in the first instance, not only in the health sector or social care sector, in every sector, in the first instance, you need to, if you want to recruit, the first thing you are meant to do is to consider, what type of person and what type of person you want to recruit. You want to make sure that whoever you are recruiting fits into the position. You want to make sure that whoever you are recruiting qualifies, qualifies for the position that is available. So you do not just go into recruitment without considering, who and what. So as far as I'm concerned, so it's a major question that needs to be answered before you can engage an officer, in whatever position that is available.
Yeah, that's true. That is true. That is true. I agree. And just like Emmanuel said, you need to before you actually decide that you want to recruit certain types of people, you need to know who exactly you want to have in your team, in the position as well. So let's delve into that a little bit more. And when you look at the type of people that you want in your team, 9 times out of 10, it's all about, their specific type. So will they be able to contribute to the balance within the team? Will there be team harmony? What would the actual prospective person bring to the team? Because it's okay to recruit someone, but you also need to recruit the right person for the job. And I'm sure within your training, you may come you may come across the aspect of being competent. So it's okay to we're looking for so yeah, it's okay for that, but sometimes you have to know, are they competent? Can they do the actual job? Litz, you've got your hand raised. Do you want to unmute yourself?
Yeah. Can you hear me?
Yeah.
Yeah. So the thing is, in health and social care, I don't think they've got the luxury to be, when they're recruiting, to think about team harmony, this and that, especially, let's say if they want to recruit a nurse, a doctor, or a social worker, so far as, because these are qualified roles and the person is registered, I don't think they've got the luxury to be thinking about all the other things, because one, there is a high turnover of staff in health and social care, and sometimes they just need the bodies to be in the post. They don't have the luxury even to think about, do you fit in? Is there about team harmony? Does the person even qualifies in terms of, yes, they are registered, but do they know their job? They don't have the luxury even to think about these things, because every Friday you have influx of people leaving, and then the next Monday new set starting. And also because health and social care uses a lot of high percentage of agency staff, that luxury when it comes to recruitment in the real world just doesn't exist in health and social care.
That is a, and that there, guys, is a very true point. So when we're actually looking at recruitment, as Lit said, there's the positive side of recruitment, and then there's the negative side of it. That in certain cases, sometimes you may not be able to dictate everything. You may not be able to dictate everything, but we're looking at it from a perspective of management side of things, because if you, let's say, okay, let's go look at it from a different angle now. You've got a service user, a client who has autism. Now, autistic people, they would like to have familiar people, the same faces. And when you're working on specific type of cases, it's better that they work with people that they know on a day-to-day basis, and it's better that when you work on a case, you ensure that the person there is familiar with the actual service user itself. Because when we talk about sharing information now, if there's a high turnover of staff, there's you don't have the right team of people around the actual service user, the service user may not get the best care and support available to them. So which is why you want to ensure that the service user involved, they have some kind of consistency and continuity within their care and support. And that's something that I will address later on in the webinar itself. So we've looked at the managers, the leaders, the senior partners, when they come to look for specific types of people in specific roles. The next stage is for them to develop a job description and what they would actually be doing. So within within our world, it's okay that it's okay that you can apply for a job, but you need to know what you are going to be doing on a day-to-day basis, and that job description there, it will add weight to your role, because 9 times out of 10, you need to be telling people what they are going to be doing on a day-to-day basis, and also what will be expected of them within their actual role. So when the managers, the leaders, and the senior partners come together to bring about a new department, let's say, yeah, and now they're looking for people to fill those jobs and fill those roles. And like Litz rightly said, sometimes there's a huge influx of people. So you're in one day and then you're out the next. Sometimes you may not be recruiting the right people for the job, but in certain cases, before people actually apply for the job, they need to know what they are going to be doing. So imagine it, what would it look like on a day-to-day basis? What would it look like for you as a member of staff? What would you be doing on a Monday, on a Tuesday, on a Wednesday, Thursday, Friday? What does your role consist of? What are the core tasks that you will be doing? And that's all part of the recruitment process. And then we're going to look at the next part of that as well. As part of their job, is there a road of progression in their job? Will they be able to get promoted to the next role up, or will they be able to get promoted to a leadership role, onto a management role? Because the whole point of bringing people into your company is that you would be able to retain your staff as well, and to offer them, you know, progression. Because 9 times out of 10, when people come into a role, if they don't feel that they can progress in that job, they will probably leave. And to address the aspect of team harmony as well, sometimes I've seen it. I've worked with people as well. When it comes to team harmony and all that other stuff as well, it's also important, because if the team is not working well, if they're not working well as a collective, if they're not sharing information about like a service user, or they're not communicating well, there can be a real breakdown. And that's the thing you need to understand when you're recruiting certain types of people. You need to make sure there's a balance. So we've looked at what type of person they want to recruit. We've looked at the job description that they will be having as well. But you also need to factor, when you are putting a recruitment process together, when you're looking to recruit people, you need to look at the things that are most likely to help them to stay within their job. So let's think of it. Will they have training? Will they be able to shadow senior members of staff? Will they be able to, you know, will they be able to attend specific training to their job? Will they be able to give their advice and their opinions on where the company can move next? So what would you offer them? What benefits are they going to receive? Now, NHS are, you know, if you look at an NHS job description now, it will likely tell you, like it'll give you the title of your role, the department you're going to be working in, what band you are in as well. Then it will give you how much you're going to be in as well. And then it will detail everything about your role, job description, and specification as well.
I'm fine.
So if we move swiftly on.
I was in the bedroom with the camera.
Okay, cool. So so guys, we've looked at okay, that's cool. We've looked at why it's important for you to pick. We've looked at why it's important for you to select certain people. We've looked at the job description and why it's important to tell people what they're going to be doing on a day-to-day basis. And we have also we've also looked at you know, who, like, we've also looked at why it's important to have things that will help them to stay within the company.
Yeah.
Excuse me while I have a sip of coffee.
Okay, bye.
Okay, that's good. That's good. So yeah, okay, cool. So we've looked at all of that, and we have also covered, like, you know, we've also covered about recruitment in general, like the different processes, the different selection, and the different types of ways of you can recruit as well. So now what we want to talk about is in the recruitment process, special expertise. Now, when we look at certain jobs, let's say a social worker. Now, and then there'll be also other jobs like a social worker, where you will have a position of responsibility. And so, if you are in a position where you're in a particular space, you have a position, you will need to, you know, look at, okay, I need some help on recruiting the right people, I need some help on ensuring that they are competent for the job. So in the recruitment process, there is going to be times where you are going to need special expertise around the staff you want to hire. Now, I can think of many ways, but before I address you guys, one key area around special expertise is the DBS, Disclosure Barring Service. Now, the Disclosure Barring Service, it replaced the Criminal Record Bureau. Reason being is that the Criminal Record Bureau, when people bought their CRB checks, it wasn't in depth. So, let's say if the company wants to hire a person to work with children, now for them to know if that person is safe to work, they need to know about offences. Are they on the child protection register? Have they got anything held against them? Have they been involved in social services before? Has there been any allegations against them in their previous job, and all of that stuff? But the CRB check didn't really offer that at that point. But now the DBS is like you're disclosing everything about the particular person. So when you go for a service user job, you're working with a service user, you are on the field. It's expected that you have a DBS, and that's part of safeguarding. That's part of safeguarding, right? So DBS. What I would like to know is, what other special expertise do you feel that we need to consult around staff that we want to hire? Emmanuel, what type of what special expertise would we need if we are going to recruit certain types of people?
Come again, please.
So, okay, cool. So we've looked at special expertise in the time that when you're going to recruit certain types of people, sometimes you will need certain expertise. So it could be around safeguarding. It could be around having a DBS check as well. So in that particular process, what other times do you feel that people would need to consult other outside agencies, let's say?
It's okay. As per the health and social care, to be candid, I'm not really privy to that, but I think, like you have mentioned, the DBS, apart from the DBS, you can also deploy the service of an expert, in terms of their qualification. Is that correct?
Yeah, that can be correct. Yeah, because that's special expertise, isn't it? It's other outside things that you need to take into consideration. So yeah, that's one. That is one. That is one indeed. And selection within that particular process is key, because when you go and look for special expertise, it's a thing of, they may have a key role in the local area that might need everybody's agreement. Like, So in you know, within the area, you will have certain types of people who work with different people within the actual area, and so for them to bring the right people in, they also may have a say. So if we look at stakeholders, the stakeholders are people who have an interest in your business. They may not work in the business, but they have a particular interest in your business and what you are doing. So that's also a time where you may also be looking at special expertise. Now, when we talk about you know, recruiting people and selecting people as well, let's also bring up the fact about service users themselves. Isn't the service user special expertise as well? Because in certain cases, it's very well known that for a company to develop their service around certain types of people, or if they're bringing in carers or care workers or like people to work with them, sometimes they will have a say on who they get to work with. Because if the company, the organization is going to be working around person-centered care, then the service users must have a say on who they want to work with them or who they want to work as part of the team. Because don't forget, the carers and the care workers, everybody within the organization is person-centered, and it's around the individuals who work in the actual place itself. So let's also think about, you know, sometimes there are different legislations and frameworks that can be needed to help the recruitment process, and there's ones that we have to follow as well. So I am going to have a look and see if I can do something. So yeah, that's good. That's wonderful. So Adiomo, I hope you are good. I hope you are well. So okay, that's not what I was supposed to be doing. Sorry about this, guys. It's a bit crazy, but yeah. Can you think of other legislations that people need to follow when they're looking to recruit someone?
If you want to recruit, for example, you need to recruit somebody about safeguarding, that is specialized in that area,
Yeah.
that is qualified to do duties, given roles. I don't know.
No, you are on the right track. You are on the right track, because
Okay.
what are the aim?
At the end of Vivian.
Vivian?
Yeah.
Okay, cool. So what Vivian told us there is what we're addressing in the particular slide about recruiting the right people. So they have to, so you know, they're in the right field. They've got specific experience. They've got specific knowledge about a particular area.
Job. Yeah.
And when we talk about special expertise as well, sometimes those people may come from a different those people may have an experience in a particular, like in a particular hospital or a particular field, but because they've got special expertise in a particular area, they will be drafted in to perform that job. So, for example, if let's look at doctors who perform surgeries on surgeons and you know, these other types of people in it. They are sought after roles, and when you're looking for certain types of people, sometimes they will recruit from within. So they will look at a hospital. Okay, I know you're working over there, but we've got a new department opening a hospital, and we would like you to head up that particular department. So sometimes that's what.
Excuse me, please, can other people mute their speaker so we can hear you well without background noise, please?
Okay, yeah, let's do that, guys. So, okay, perfect. So, yeah, as we were saying, so sometimes they will go and look for expertise in that field from other places and other settings and other hospitals or care agencies or like talent pools as well. So when we look at special expertise and frameworks as well, it is to be expected that they work within that particular framework. So a particular framework may be around safeguarding vulnerable adults. There's a particular framework that will help you with your recruitment process. So just to recap quickly, guys, we have covered a bit about the recruitment process, what is involved in the recruitment process itself. We have also we've also covered that we've also said that for employees it's a more rigorous type of process, right? And we have also said that the process will be even more rigorous for employees. We've also covered about the type of things you need in your recruitment process. So job description, job specification, you know, job progression as well, and what people can do within their job too. And we've also covered like about leaders, managers, and we've also covered senior partners and their role within recruitment. And we have also covered about you know, benefits and other stuff like that as well. So the next thing we want to talk about is, you know, we want to talk about the actual selection process itself, and I think we've covered a little bit. So yeah, okay, cool. So yeah, you can. Okay, that's good. That's cool. So yeah, before we you know, before we carry on, let's talk about selection process. Let's talk about the selection process. Let's talk about the selection process itself. What ways do you feel employees can select the right people? What tactics can they use to make sure they select the right people? Litz, you've got your hand up, so yeah, do you want to unmute yourself?
Yeah, I mean, I got my hand up because you did touch on legislation and framework that enhances the legislation and the selection process. However, we didn't discuss about it, and that was what I wanted to talk about. because I think it's important in terms of the legislation, because in UK, there are a number of legislation that you have to consider when you are employing. And also we've got the safer recruitment in terms of GDPR, in terms of data protection, in terms of Equality Act, and also Disability Discriminatory Act. And those things are important when you are recruiting. So that was the contribution that I wanted to add for raising my hands up.
That's perfect. And just to let's address that particular thing, because selecting the right people is all about looking at the different legislations and framework as well. So let's raise up a great point around GDPR, data protection, and you know, safer recruitment as well. So just like we said, the DBS, safer recruitment is all about how you can recruit people in a safe way, and the different legislations, they're so important, because when you look at the legislations, the government are basically telling you that this is what you need to do to recruit fairly. And so when you let's look at the Equality Act, for example, are you giving people equal opportunities to apply for your job? Is there an equal opportunity? Is there an opportunity for everybody to be able to apply for your job? Or are you segregating certain parts of the industry, let's say, the GDPR, let's say, around safeguarding, sharing information as well? Are you storing the right information for what you need at that particular point? So there is many legislations out there that will help frame your recruitment process. And then let's also maybe go one step further, the Disability Discrimination Act. Now, when I talked about service users getting involved in the actual application process, sometimes you may have a person who has a disability themselves, and they would like to apply for the job. So they've got the qualifications, they've got the experience, they've got the knowledge, but they've also got a disability as well. So those are some of the things that you need to consult within your role. You need to look at those particular things, and you need to understand, okay, cool. So I know what the Health and Safety Act says. I know what the Safer Recruitment Framework says. I know what the Safeguarding Vulnerable Adults says. I know what the Disability Discrimination Act says. I know what, you know, the Care Act 2014 says. I know all of that, but how am I going to apply that to the recruitment process? And how is it going to help us moving forward? So they're just some of the aspects of legislations and frameworks that we need to understand. And that will help us when we go to select certain types of people. So when you go and look for certain types of people, you know, there's different ways that, as a company, as an agency, as a service, there's the different ways that you can select certain people. Now, when we talk about the recruitment process, this also forms part of it as well. So I want you to look at the bottom of the screen. Claxton House, they're part of Atlanta Healthcare, they're a residential care provider themselves. They said this bit, it says, don't just fill the vacancies, fill them with the right people. Don't just fill the vacancies, fill them with the right people. And if we revisit what Litch said about, you know, there's often a high turnover of staff within the industry itself, and sometimes employers, they just fill the jobs. So when you're looking at a particular agency, they have people working for them, but is it the right people? Is it the right people working for them? Can you say to yourself that I've got the right people working within the team? Or is it a case of you've just gone to, you've just recruited anybody who can do a job? But when you're looking after a person's well-being, and you're taking the factor of safeguarding, the Safeguarding of Vulnerable Adults framework, let's say, are you filling those jobs with the right people? And that's what we need to understand when we are going to recruit people, when we are going to select people as well. Are they the right people for the job? Are they competent enough? Will they be able to deliver the right care and support that a service user needs? Because don't forget, it's all about person-centered care. And sometimes we know that there's a quota that management needs to meet. So they have to recruit certain, they have to recruit a whole number of staff within a whole couple of months. But sometimes you got to look at it from the aspect of person-centered care. Are they the right people? Because when you look at it, if you're putting, let's look at it from this aspect, you're putting together a care plan for a service user. And then you're also working with multidisciplinary teams as well. You've got to look at it from the aspect of, okay, who do you want to be working with the service user themselves? What do they have to contribute? And then you've got to look at other aspects. Are they sharing information? Are they working in partnership with each other? That's what we meant by team harmony, partnership. Is there an aspect of partnership working there? Do they respect people's views? Can they listen to a person's opinion? Then give feedback as well. But if you just fill your vacancy, if you just fill it, you are running the risk that you may not be able to give care and support to certain types of people. So let us move on to the next point. That's just some of the things that we need to understand, that as care professionals, as managers, as leaders, as business owners, that we need to be filling roles with the right people. We can't just be, we can't just be filling the vacancies because there is a vacancy to fill. You need to fill it with the right people. And that's where the selection process comes into play. So let's talk about the selection process now. Let's talk about the selection process now. So when you want to select people for the job or the role or the position at hand, you need to think about how you're going to select them, where you will select them as well. So let us look at let's look at selecting people. Will you select them in-house, or do you go out of house to go and find them? So selecting people in-house, is that a good idea? Or should you go and look for people outside? Is that a good idea as well? Because let's look at NHS. In some jobs, in some places, they don't recruit outside. They recruit from the inside. They recruit from the inside. And why? Because the particular individual has been working for the NHS for a good 5 to 10 years. They know about the values of NHS, they know about the ethos of NHS, and they know everything what NHS done as an organization, as a service. And now when they go to apply for a new job within the actual team, they may stand a better chance of getting the job. But if you then go and look outside, you can do that. You can look outside as well, can't you? You can look outside of your particular thing as well. So that's some of the things you've got to weigh up. You have to weigh up. And then you also want to look at other places where you can select people from. So what about specialist sites, recruitment sites like Indeed or LinkedIn or social media? So you may have a TikTok account. I'm sure NHS might have a TikTok. I'll have a look. So NHS might have a TikTok. Your local care provider may have a TikTok as well. And so through there, they're able to interact with different types of people. And when it comes to selecting people they would like to work with, they may select them from that particular place, or there's something called talent pool. So what a talent pool is, you know, when it's like a talent pool is where you as a professional can sign up and you can be part of that talent pool. So when we're looking for jobs, when you're looking for a job or the actual service are looking for people to recruit, they will tap into the talent pool and then they will say, okay, cool, so this person is good for the job. Let's go and offer him the job because he's a good person, isn't it? So that's about selecting people. And all what we've covered so far is very important because number one, you want to have a good recruitment process. You also want to ensure that your recruitment process is fair and you are not leaving anybody out. Like everybody has a chance to apply for the job. Everybody has a chance to go for an interview as well. And everybody has an opportunity to state why they are fit for the job, why they should be able to do the job, right? So that in itself is important. And then we've also discovered that selecting people is also good. It's important. And that's like the statement at the bottom says, don't just fill vacancies, fill them with the right people. And that's also important, don't you think? So let's now move on to another part of why recruiting people and selecting people is important. So let's now go over to here and we are going to look at the aspect of, okay, cool. So we're going to look at the aspect of child abuse and serious case reviews. Now, I don't need to explain to you about child abuse and serious case reviews, but we'll do that anyway. So over the years, there's been a lot of high profile child abuse cases, high profile ones. So off the top of our head, we can think of Baby P, Victoria Timbier, and also Tia Sharp. I would like to get feedback from you all. What other case reviews have you come across within your line of work? Are there other ones that you feel we haven't mentioned here? Litz, what about you? What about yourself? when we talk about serious case reviews and child abuse, are there other cases that you may have seen in the news lately?
I mean, for me, I'm a qualified social worker.
Yeah.
So we do have a lot of child abuse cases
Yeah.
that the recommendation would be for a review. Not all those cases makes its way to the public or to the news, apart from the big cases like Victoria Clembier and Baby Peter, and also Charlie that recently happened in Birmingham. And it's mostly due to the disorganized way of professionals not talking to each other and the care not being coordinated well. But in social work, there is always ongoing case reviews.
Yeah, definitely. So yeah, so thank you for that, Liz. And so yeah, like she said, there's always going to be you know, child abuse cases, high profile ones, and ones that we don't really see in the news as much. But a serious case review is technically what it said, but it's a serious case review is when an independent official is looking at everything that has happened which contributed to like a person's death, or if they came to or if they came to harm, and they're looking at the failures of the system and why it actually happened. And so, as we said, we see Baby P, Victoria Climbier, Tia Sop, and like Charlie, the lad from Birmingham as well. So out of those case reviews, out of those particular reviews, we now have an influx of policies and procedures. And those policies, procedures, they are a direct result of the serious case review. So a few here listed, a few of the ones would be the Safeguarding Vulnerable Groups Act 2006. So that's basically, you know, that act came in 2006 because of the fact that they have to safeguard different types of vulnerable groups. So let's think of it. Children who may have a disability, vulnerable adults, you know, you may have other different types of vulnerable groups as well. But that is what that aspect of the act is. Then you've got the Care Act 2014. Now, the Care Act 2014, it was the Care Act 2014. Yeah, so you got the Care Act 2014. So, you know, whole reason for the Care Act 2014 is that, you know, it's there to reform. It was brought in to reform the law, which you know, it helps to improve like people's independence, their well-being as well, and it really brought together a new aspect of providing care and support for adults. And also, it also came about because, you know, there had to be certain arrangements for services in the industry to help people who had needs of their own, and they needed care support, and they couldn't do it themselves. The Care Act 2014, that was basically what it was all about. Now, in 2004, we all know what took place in 2004, don't we? In 2004, you know, we had the case of Victoria Climbier, didn't we? Now, the Children's Act 2004, it didn't replace the Children's Act 1989, but it's a development. It added more to it. And the reason being is that when Lord Layman, he made his inquiry into the Victoria Climbier case, he brought in certain recommendations that people need to do and people need to work with as well. And he said a whole lot of things as well. And we also have the Children's and Young Persons Act 2008 as well. That's not listed there, but that's another one that came out of the Children's Act 2004. And basically what that is basically around safeguarding and intervention as well. If you on the basics of intervention, that particular act is almost like it's in a child's best interest for a professional to intervene at a certain point, at a certain case. And so it set boundaries for local authorities and other people that work with them to go and intervene in their case. And they should have a good reason to with it. Now, another act that happened that came out of a serious case review was the Children and Social Work Act 2017. Quite recent, pretty recent indeed. Pretty recent indeed. But this act, so this act, this act, it's all about looking at the looked after child. So you got the Children's Act, you got the Children and the Care Act, but now you've got the Children and Social Work Act. So basically that one is when you're looking at looked after children and providing the right care and support for the looked after children in your care. And so it was, like we said, it was introduced in 2017 by the government themselves. And the reason why is because, like to make provision for the relation of the welfare of children as a looked after child, and also to help regulate the social work industry, too. And part of that act is they brought in Social Work England. So Social Work England was the main body of regulating social workers in the industry itself. And so the last one we have there is Working Together to Safeguard Children 2018. Now that again is another recent one, but that is all about interagency work and multidisciplinary teams. So this is particular guidance. It's guidance. It's guidance for teams, multi-teams, interagency teams. So if you think of it, in child protection cases, or when they're going to intervene in a child's life, or they're working with a certain individual, let's say, this basically gives them guidance and information on what they can do to safeguard the individual itself, and also how they can work together to safeguard children and what they need to do to safeguard children themselves. So they're just some of the acts, legislations, policies, and procedures that have come about from these serious case reviews that have come about. And I'm sure that you are well aware that when you have serious case reviews, when you look into why a particular child abuse case happened, or you look at why certain things happen, you will then maybe look at it from an aspect of maybe it's a systematic failure that we need to work on and that we need to make better. So let's look a bit back on what we've covered. So we've just looked at child abuse, serious case reviews, and like Let's said, they highlight some of the failures within the industry today, and it will also give recommendations of how you can improve in the industry today. It will also give you recommendations of where you can improve, and it will also bring in certain legislations and acts, like we said on the previous slide. And so after everything we have talked about, we now get to a point where when we look at the recruitment process and the selection process too, we now get to an understanding of, okay, now we understand why we need to work with the right people and why we need to select the right people as well, and why there are legislations that underpin our work. And we now understand why there are specific types of people that we can consult about the people that we want to recruit. So everything we have said here is all to give us an understanding of why the recruitment process and why the selection process is of importance. So let's move on to another aspect of managing people within health and social care. So let's now look at, we're now going to look at training and career development opportunities that are available for individuals within your company. So, sorry guys. Oh, yeah, okay, that's cool. So, when we talk about managing people within health and social care, it is often expected that as part of the job, as part of your role, you would be helping to develop the staff that work within your team, or within your service, or in your setting. Now, you know, two areas that you may work on is individual training and group training as well. And for both, you have to come up with certain ideas and ways that will help develop both. So, you know, you may see here that you can set objectives, you can set targets, you can set performance reviews, and you can also set benefits around meeting certain goals. So Litz, do you want to unmute yourself? Like within your role, would you say that you have specific training within your role in-house?
Yeah, we do, because one, for registration purposes, continuous professional development is a mandate.
Yeah.
So you can't do anything about it. You need to do X amount of training every year to qualify for re-registration, and we register every year. And as part of your registration, you need to fill in your CPD portfolio, as well as the training you've done, what you have learned, how you translate it into practical terms. So training is ongoing, and the training needs depends on your caseloads, the cases that you have, and then the training needs might be identified through supervision, Or you can also recommend that actually you have this case and you could do with maybe a training in trauma development or trauma therapy or whatever, or you have a lot of court cases and you want to refresh on your court craft training, or whatever through training, and also some of it through your appraisal progressions. You have to do certain training to enable you take on more complex cases.
Yeah, and that's good. Perfect. That's a perfect example of a service of a setting helping develop their staff within their role. Adiemo, how about yourself? When it comes to training and career development within your role, do you receive that type of input from the management side of things?
In my country, like Nigeria,
Yeah.
we do training once in a while, not like UK.
Yeah.
Because unless you are a qualified nurse, as an auxiliary nurse and a health worker, it's once in a while. And Nigeria, I don't know how to put it. It's not the way they train UK, the way they train us. Most things I learned from through online. So I can't really give more details about it.
Okay.
Yeah.
Okay, that's perfect. And Emmanuel, how about yourself, my good sir? Have you the management in your place? Do they provide training, career development? Okay, that's cool. Okay, so okay, that's cool. That is cool. That is cool. So yeah, let's so we've got we've talked about career development and just some of the ways you talked about that and just like some of the ways that a manager or a leader can set specific types of training. So within that, you will see that there are different opportunities within the health and social care sector. So we can think of, you may have in-house training. So like first aid training, or you may have mental awareness training, or you may have safeguarding training, or you may have trainings that are delivered in-house to in-house staff. This is just basically to broaden everybody's skills and their knowledge and their understanding of certain types of things in the industry today. Now, you may have shadowing. So if you're going to help, develop the individuals that work within your company, you can get them to shadow different people and in different roles. So before they actually apply for the job, they can see what it would be like, and then they will be able to see what they will have to do as well as part of the role. You may also have other other development paths such as job promotions, and also the aspect of the other aspect of working with different partners within the industry as well. So, you'll be working with different partners. So, for example, if you work for the NHS, you may find a job with the Department of Health. Or if you work as a nurse in a hospital, let's say, there may be an opening for you to be a district nurse, or you may have the opportunity to become a community nurse. So within the aspect of health and social care, there are different times where you may be working with different partners, or as I said before, you may have it as a multidisciplinary team or an interagency working team, where you may not leave your job, but you will work with other individuals who have certain roles. So you may be working with a social worker, you may be working with an OT, a psychologist, you may be working with a dietitian, a nutrition as well. Everybody who's involved in person-centered care, let's say you'll be working with them and you'll be learning about what they do and what they contribute to the development of a service user. And so as a manager, as a leader, as a business owner, sometimes they have to help you identify what your plans are for your career. So you want to become a social worker. Okay, that's cool. But where does your career in social work look like? How does it look like to you? In 5 years' time, where would you like to see yourself be? In the social work field, but what role would you want to be working with? Do you want to work in a local authority, or do you want to work in different authorities in different cities and different countries? What would you like to do within that particular industry? So if the manager knows, then he can help look for opportunities that will develop your career. So, okay, so let's look at certain development opportunities. So, as a care worker now in a particular agency, you've got care worker, you've got different levels, got level 1, level 2, and level 3. After care worker, you will have care coordinator, let's say. And then after care coordinator, you'll have care manager. And in between there, you'll have care supervisor as well. So don't you see that there are certain aspects within care that people can do and people can work towards as well. And then people can do training around being a care supervisor and care coordinator and care manager as well. And, you know, as you guys are studying level 7, health and social care, there will be different aspects of different types of levels and what you can do once you get that actual qualification. So let's now look at what else the manager has to do when looking at career development. So, you know, part of like looking at certain opportunities for the individuals at hand, you would have to think about the structure of the organization. So within the organization, you know, you will have like your managers, your senior partners, your leaders, your supervisors, your senior supervisors. You'll have your, you know, you have your team leaders, then you have your leaders, then you have your departmental leaders, then you'll have the staff underneath them. So when you're looking at opportunities for your staff, you got to look at the structure of your organization first, and you have to think about whether whether that structure needs a particular role or whether that particular company is right for the individual at hand. And then you got to think about is there progressing within the company over a period of time? So just like we said at the beginning about recruiting people and also selecting the right people as well, you've also got to think about, can they progress within the company? And if they can progress, what is it they can do? How far can they go? Because as we said before, when it comes to recruiting people and selecting people as well, you want to offer a route of progression in the job. So in the job, can they go from level 3 to level 4, to level 5, to 6, to 7? Is there opportunities for them to study those particular levels? In the job, is there particular places where is there particular opportunities for them to do other jobs within the industry, or is it a fact where there just is no progression within the company at that time? So as for managers and leaders within and senior partners as well, they need to look at the structure of the company, and then they got to look at, is there time for people to progress in the company? And that, I think, is very important, because when you have an individual who works within your company at a certain level, for you to be an effective manager and for you to build up your the people that work with you, you also need to offer them the development. Because I heard a statement once, and the statement was, if there's no progression, you will have stagnation. So if there's no progression, you will have stagnation. And what that means is that with your team, with your individuals, within the group of people that you work with as well, you need to make sure, making sure that they won't be less stagnant in their career. So they've done a level 2 in health and social care. They've got level 3 in health and social care as well. But where did they go next? And as a leader in your company, as a manager, as a senior partner, you need to be looking at those specific roles, and you need to be working with the individuals. Okay, so we've spotted an opportunity for you to do some training within safeguarding or within care supervisor, or we feel that you've come to a point where it's time for you to move to a new role within the company itself. If you are able to identify and spot what they are good at, then you are going to have a better opportunity of working with the individuals you'll have a better opportunity of working with the individuals at hand, and you will have a better opportunity to develop their career as well. So far, sorry guys, so far we have looked at recruitment, we've looked at the selection process, and we have also looked at other parts of the industry. So like the different legislations, we've looked at frameworks, we've looked at why you will need special expertise at some times. And then we have also looked at other parts of the industry as well, such as, selecting the right people. Where will you go to select people from? Your recruitment strategy, what is it like? Is it fair? Can people apply for your job and be fairly given an opportunity to apply for the job? And then we've also looked at different case reviews and child abuse, and like what came out of it. And then we've just now looked at career development and training as well. And so when you look at the selection process and the recruitment process as well, that also forms part of it. It's also part of managing the right people as well. So when you become a manager, you can actually help develop your staff. And if it's a group training you want to do, you can put on training for the whole group, so they can also learn as well. So let's now move on to the final part of this webinar. Then I'll open up for questions and stuff like that as well at the end. So let's also now look at career development in the context of performance management. And this is my favorite one. I love talking about performance management because I like football. I'm a football guy, and you know, I play football manager as well. But when it comes to managing people's performance, this is so very important, because if you remember at the beginning, we talked about competency. We talked about competency and making sure that they could do the job. This is what performance management is all about. So let's delve into that a little bit. Let's delve into performance management a little bit, and let's talk about performance management. So performance management, what is it all about? Performance management. So in your job, in your role, whatever role you do, you may come across different people who turn up at your work one day and they look at what you do and they'll give you a score out of 10. So let's look at this, the CQC, for example, the Care Quality Commission. One day you might walk into work and you're told that as part of the management process and seeing how staff perform, someone from CQC is going to be having a look at what you do. Or someone from the company, but they work higher up, they're coming to look at what you do in your role. So performance, it all relates to how individuals perform within their job. So as a social worker, how do you perform within your job? How do you perform within your job? As a care worker, how do you perform in your job? As a supervisor, how are you performing? As a care manager, how are you performing? As a district nurse, a community nurse, a psychologist, an occupational therapist, how are you working in your role? How do you perform on a day-to-day basis? So when we look at performance management, there's also different ways that you can measure how people are performing. You can measure their performance, and there was different ways. So some of the ones there you can see are supervision. Now that one is key because you'll have a supervisor within your team, and if they want to see how you perform, they may just come and see what you do on a day-to-day basis. So they may do random spot checks. So they may not tell you when they come in, or they will agree with you a certain day and a certain time for you to show them how you perform in your job. And then that's how you, and then that is the supervision part of it, or they may just not say anything to you, but they may just be standing at a distance and looking at how you perform your role and in your job. And so after that, they may come to you with what we call a developmental report. So what that developmental report is how you are developing in your role and how you are performing too. So then they will be talking to you about the aspects of your role, what you do good, what you are doing good, and then like some of the areas where you need to get more training on, or where you need to improve on, or some of the aspects of where, like some of the aspects of where you need to, of what you need to look at as well. So Adeyemo, in your particular role, do you have supervisors who give you regular feedback about your role and your job?
Yes, I have a supervisor. If he asks me, if he gives me a job or he wants to supervise me, if we have the patience,
Yeah.
so it will be there. He asked me to do it, to take a vital sign, and he will say the way I will handle it, and I will get feedback.
Okay, that's cool. That's cool. And yeah, I mean, that's an important part. That's an important part of performance management, because as a manager, your remit is to help develop your staff, but also see how best they perform in their role too. So yeah, that's pretty much it. So now, part of seeing how your staff perform is get your staff to do a SWOT analysis. So a SWOT analysis, if you haven't heard of it already, stands for strength, weaknesses, opportunities, and threats. So strengths can be, what are you good at? What are your strengths? Are you a good leader? Are you a good communicator as well? Are you a good team player, etc., etc.? Weaknesses are like the weaknesses are the places where you are not so good at, like the places where you need a bit more work on. Opportunities are your opportunities to work on those weaknesses. And then the threats, they come like, so the threats are basically, there's an opportunity, but what might stop that actual opportunity from me doing the actual thing? And so you can also have regular reviews as well. So regular reviews can be like after you've finished your shift, or you've you've worked on a high-profile case, or you've worked on a specific goal, or you've worked on a specific project. And after that project, you'll meet with your supervisor or manager, in this case, and you'll have a review about what you did, what you didn't do so good, and what are some of the things they've spotted as well. And then another part of it is by asking questions. Now, asking questions is the most greatest way of assessing how someone is performing in their job, because you've got the theory part of the job and you've got the practical side of it as well. 9 times out of 10, the practical side of it, people look at, but people don't look at the theory side of it as well. So within your role, you can be working, but if a manager comes to ask you questions, so for example, I don't know, for example, you're working on a case and you want to report an allegation of abuse to your supervisor. Your manager may ask you a question. What are you going to be telling your supervisor? What information would you tell them? Or they may say something like, when would be the best time for you to be telling your manager about this case? So it's not that they want to catch you out. They just want to test you on what you know. So it's a bit like you having a driving test. You're practically driving, but the driving instructor wants to see whether you are theoretically sound and you're performing theoretically as well as practically as well. So when people ask you questions, it's just to get a good understanding of what you know already. Now, for individual training and developing people's needs, there's going to be many methods in which you can do it. So, you know, like, so you may go and look at feedback from people. So these people can be service users. So supervisor, go to a person's home, or they may stay in the particular setting, and they will but get like feedback from the service users. And they will say, yeah, okay, I like this person. He did this and he did that. Or I don't like that person. He doesn't do his job. He doesn't do his job properly. So all of that is included in feedback from other people. Or it could be like from people you work with, or managers, or leaders, or senior partners, or other people that have come to see you in your job. That feedback is crucial when you have meetings with your supervisor or your upline. So they will be speaking to you about all of that and seeing where you need to improve. And if it's good feedback, highlighting what you are doing good as well. And so part of part of feedback is getting the individuals working with you to reflect on their practice. Now, reflective practice is a very key thing, because when it comes to development and performance management as well, as we said, after a project, after a case, after your day at work, after you've signed off you've signed off on a review, let's say, now would be a good opportunity for you to reflect on what you have done. And it's a good opportunity for you to reflect on your role today. And that's part of reflecting. You're basically looking at it and you're saying, okay, so this is what I did. This is what I didn't do. And also this is what I feel I can contribute next. And also what I feel I need help and support in. And so reflective practice is basically good for you to reflect on your job and on your role. And then you will be able to take that particular practice back to your manager or your supervisor or your upline, and they will be able to sit down with you and put together a plan. Now, when we talk about plans, first of all, you've got to see if it's beneficial. Is that plan going to work? And also, like, will there be clear progress afterwards? So you've spotted places where people need to, we spotted places where people need to work on, but is it going to work? Will it be beneficial for them? So another method that you can use to for performance management is CPD, continual personal development. This is basically where you are continuously developing in your field. So it could be nursing, care work, social work, occupational therapy, psychology, therapy, counseling, as a coach, and other industries that are out there today. So you're basically looking for opportunities where you can develop your skills and your knowledge in your particular field. So how can you promote CBD? How can you promote CBD? Now, let's also discuss that a little bit before we wrap up this particular webinar. You're going to have various techniques to promote CBD. So you may have the opportunity to attend events, shadowing, like we said before. You as a care worker, you may have the task of supervising new staff. So let's say you go into a client's home, there's someone that hasn't worked in care before. You may have the responsibility to show them the job. So every client you work for, you'll update them on the client, like the service user, and you'll be telling them certain stuff around the job. And then you will have works, you may even have workshops in it. Like you may even have workshops. But then you got to think about, is it worth it? What impact will it have? If you get someone to shadow a new person, will it work? Is it going to be, is it going to be effective for them? And that's some of the things that you need to understand within performance management, because sometimes some aspects of development and developing staff is just may not work for certain people. But then we also have to come to the realization that, you know what, this is good for them, because if they want to become a supervisor in their field, they can supervise new staff. If they want to apply for a job in a particular area now, that particular area, is it good for them? Is that area good for them? Can they develop into that particular role? Attending events. So it may be a networking event, or it may be talking about safeguarding or other stuff that, like, maybe the NHS put on, or the government, or the Department of Health even. Are those events going to be beneficial for your staff, for individuals, and for groups as well? So they're just some of the various techniques that you can promote CBD. So at this stage, we're gonna open up the floor for some questions. But before we do that, let's go back on what we've reviewed, what we've talked about before. So let's just go here. Yeah, boom. So we've talked about recruitment. We've talked about the selection process and why it is important for, you to select the right people and to recruit the right people as well. We've also looked at, the benefits of having special expertise within that particular industry. We have also looked at where you can look for people and how you can select people as well. And then we've looked at legislation, frameworks about recruitment and selection people as well. And we've also looked at different child abuse cases and why those actual legislations came about. We've also spoken about career development too, and why that is also an important aspect of the managing people and making sure, like, you know, they are competent for the job as well. And we've also looked at like career development as well, why you need to help them develop their career. And finally, we have looked at performance management, and we have looked at a different type of performance management that you can have within your company. We've also looked at developing needs, feedback, and how that helps shapes the individual. And we've also looked at CBT and what type of CBD you can do. So yeah, that's pretty much all about managing people within health and social care. So Adeyemo, do you have any questions about what we've been through today?
Don't have too much questions, but I'll soon go to work.
Okay.
Question, because I'm afternoon duty.
Okay, that's good. So yeah, so basically, like, you know, like, you know, within your job and stuff like that as well, you are going to come across times where you have to do certain stuff in your job, but do certain roles and speak with certain people, or you may have the aspect of managing people. And everything we have said today is an important aspect of managing people. So yeah, I just want to thank you for attending the webinar today. It's been a pleasure of sharing my knowledge and some of what I know with you all. And I hope that what we have studied today will benefit you in your job, in your career, in the qualification as well. And yeah, so basically, use that information to, when you now go to manage other people, like when you now go to manage other types of people, you will have other aspects, won't you? So yeah, so that's pretty much it. What about yourself, Litz? Do you have any questions, or is there anything you would like to contribute to what we've